The next type of tumor that we'll be talking about is what is known as a gastrinoma. Gastrinoma. All right. So gastrinoma, from the word gastrinoma, you can actually pick out what gastrin, right? So that's what a gastrin producing tumor. So if you have a gastrinoma in the body, it's most likely that later on now gastrin levels will go very high. That's what is known as what hypergastrinemia. All right. So as you are discussing a gastrinoma, you are as well discussing what hypergastrinemia. All right, because the complication of what gastrinoma, that's a gastric producing tumor, will be what high levels of gastrin in the body, which is what hypergastrinemia. All right, so let's have it and talk about it from the types to the clinical presentation to the diagnosis test to the treatment and complications that could follow. For definition, we see that gastrinoma is a rare neuroendocrine tumor that secretes excessive gastrin. All right. So if you have this type of tumor here, there will be too much gastrin secreted, and this can lead to what? Ulcer, which could be gastric ulcer or duodenal ulcer, or it could even affect the pancreas. You get. All right. So if it produces what excessive gastrin leads to what excessive acid production, and this can lead to what is known as Zollinger-Ellison syndrome, or it can also lead to what ulcer. You get, because I'm actually coming here because I'm currently teaching students on ulcer. Okay, so what are the types? You have the sporadic gastrinoma, which is no genetic link. Then you have the familial gastrinoma, which is associated with both multiple endocrine neoplasia syndrome. So what are the clinical presentations? It can result into peptic ulcers. The patient could be having diarrhea, there'll be abdominal pain, there'll be weight loss, there'll be nausea and vomiting, there'll be gastroesophageal reflux disease and all of that. Okay, so you can see that. What are the diagnostic tests? You could do serum gastrin levels where you are trying to what? Find out the levels or the amount of serum or gastrin in that individual. Okay, they could do gastric acid secretion test, endoscopic ultrasound, CT scans, MRI scan, Octreoscan. All right, then biopsy will be the gold standard for that. All right. So looking at this, what is the treatment? Same treatment you actually apply to ulcer. Okay, so proton pump inhibitors. Proton pump inhibitors, okay, like I think it's omeprazole, esomeprazole, losamprazole, and all of that. Then histamine 2 blockers, octreotide, surgical resection, where you try to like cut the areas that are affected by that. The chemotherapy, the radio frequency ablation, the liver transplantation. That's if there is metastasis to the liver, okay, now transplant the liver. Complications, we have already spoken about the complications already under the presentation, right? Presentation is basically complication, right? So that's it for gastrinoma, which is basically what gastrin producing tumors.